A community alcohol partnership is due to be launched in Fratton next week. One of its aims is to reduce underage drinking, and it's been spearheaded by Portsmouth City Council. Joining us in the studio now to tell us more from Public Health Portsmouth, it's Health Development Officer Karen Monteith. Welcome, Karen. Thank you for joining us.
Thank you.
So what is being launched next week? Tell us.
So next week what we're doing is we're launching the CAP at the Bridge Centre in Fratton. It's an opportunity to bring together retailers, local customers, residents, young people, positive activity people all together to bring them to raise awareness around alcohol.
So the CAP is Community Alcohol Partnership.
That's right.
And this is getting different groups together to try and solve excess drinking. How does it?
Yeah.
What's the thinking?
CAP is national. The local one to us is Hayling Island. So in each town it will differ depending on the people that are involved. So for us, we've been really fortunate to get lots of retailers on board. We've got schools and also sort of local businesses as well. Our police as well are joining us. So lots of different things. It depends really on the environment and where you are, but Fratton and Milton have been really good. We've also got the big Fratton local there that are working with us.
So I guess it depends on the organisation as to what their influence would be. So in terms of say the police are going to be on board, what will they do, or how will they help?
What they'll be doing is they'll be looking and speaking to people. They've also been given some good contacts about if they're worried about young people, where they can be signposted to, which is on our Sorted website. So it's more about asking questions and working together to find solutions as opposed to trying to look for problems.
Okay, so the launch event itself, so anyone can go along. Where would they go? How would they get involved?
Yep, so it's in the community hub, which is in the Bridge Centre at Fratton. Come along between 1 and 4. We've got lots of different people coming to talk with us. We've also got people from Bransbury Park, from Pompey in the community that will be there to speak with young people. We've got wellbeing workers coming from Portsmouth City Council that will be able to speak to any residents that have concerns, and lots of information around young people, underage drinking, and the law that goes along with that.
And is that next Friday?
Next Friday, Friday the 13th.
Okay, so you said young people might be there as well. But for young people, it's a difficult thing, isn't it? Because those that possibly want to drink might not necessarily go along to find out that they need to drink less or help about that. How do you see that working?
Well, for myself, I work in schools and colleges, so I educate young people around the harm reduction and the risks around alcohol and give positive information to them so they can make their own informed decisions. So we're already working with young people. So what this is about bringing all of that work together. Okay,
so do we know it's worked anywhere else?
Yes, it's definitely been successful in other other towns around in the country, and if it succeeds very well in Fratton and Milton, which we'll know in a year, then it will grow in the city. So we've already taken all our baseline assessments, so retailers, residents, we've spoken to people at the QA, the ambulance and our young people, and we have a year to see what we can do in the area.
So when you're talking about baseline, so is this things like where you're saying, let's say shops where young people are trying to buy things that really they shouldn't be buying,
yeah.
And where they're being admitted to hospital, for example, for the results of the excess drinking? Is this that sort of thing?
Yeah, so retailers have all recently been on a course that was led with Trading Standards and with the CAP, so they've been better educated around that. And also with the QA, they give us statistics of young people, and we have a way of being able to follow that up if young people are looking for some support. So we are trying to cover that from all angles, but ultimately what we'd rather do is prevent rather than treat.
So you mentioned that you're telling the youngsters in schools the sort of benefits of reducing their drinking. What are the benefits?
So for young people, a lot of it works out to be peer pressure, so they want to go along and socialise and be with their peers. So really the sort of quick keep safe is to make sure that someone always knows where you are, that you're eating, so you've got really sort of like good amount of food in your stomach, that you try to drink water in between drinking drinks, and also that you've got a safe way to get home. It's as much about keeping yourself safe, but also having good, safe friends around you. And always when I educate in school, I'm encouraging them to go home and talk to their parents to make sure that they're having open conversations around their expectations about what they're doing.
It's very difficult though, isn't it, for youngsters to actually talk to parents sometimes. How do you encourage them to do that?
I think to begin with it would be easier to have these conversations when they were younger. So young people are often quite curious about alcohol from a really early age, watching things on TV and films. They're quite influenced by media. So if your child begins to ask you questions at a very young age, respond with that and let them understand, and to build those relationships so by the time they are 15, 16, that they feel a lot more confident and comfortable with you. But if some people are worried about talking to parents, within school, every school understands how to be able to contact us at Sorted. We've also got a website and an app that you can download. There will always be somebody that's around to listen and to help for you to make good decisions.
That's brilliant. So that's the Community Alcohol Partnership launching in Fratton next Friday. Thank you very much for joining us, Karen.
Thank you.